So, Ivana, why do you want to be a nurse?
Oh my gosh, there's this Lillian Wald lady, and apparently she started nursing, and I mean she was so many things, like a public health person and a social worker and a nurse and so much more. And she was a woman before her time. You know what I mean? And super smart. I guess she became interested in nursing after seeing her sister give birth, and graduated from the New York City Hospital in 1891, and she was only 22. So originally she enrolled to go to medical school to be a doctor and all, and after that she was volunteering at the same time, going to immigrants and poor people's houses, in the New York City tenements, to give them nursing care. Well, apparently things were so bad, she had to make a difference. She knew she had to change the conditions that she saw, and so she abandoned her plan to be a doctor and moved to this house on Henry Street so she could be closer to the people that needed her. I mean, seriously, no, seriously, how noble can you be? So anyway, eventually, I guess this house sort of became the Henry Street Settlement in 1893, which evolved into the Visiting Nurses Society. And I think there was no money, and there was only 10 nurses, and they were giving hygiene lessons to the poor and the underprivileged, and teaching them about the spread of germs and disease, and preventative and acute and care like that, you know. And then basically she gave birth to the public health nurse. Without Lillian, oh my gosh, I don't know where we would be today. So this place on Henry Street, it really expanded, and it's kind of super big, and it still exists today. Apparently her legacy lives on.
So, Ivana, I noticed you're wearing something around your neck. I thought you weren't allowed to wear those kind of things.
Oh my gosh, this is Lillian. I wear her around my neck, instead of a cross, so I can keep her close to my heart, you know, sort of channel her spirit when I'm working. My motto is, instead of what would Jesus do, what would Lillian do? A guardian nurse on my shoulder, warning, Ivana, don't do that. Oh, I know, right? So I guess Lillian went on to do other things. She really helped kids and stuff. But I mean, that conversation is for another time, because they're serving hoagies and grinders in the cafeteria, and the lunch lady is here. Peace out.
I owe my very existence to Lillian Wald. My great-grandmother was a kid in the early 1900s. Healthcare back then was awful, just awful. My family couldn't afford good healthcare or their own private nurse. Miss Wald changed all that. In 1902, she got the school system to provide New York City's very first public school nurse. Her name was Lena Rogers. In her first month at the school my great-grandmother was going to, she treated 893 students, made 137 home visits, and helped 25 kids who got no medical attention before get all better and go back to school. My great-grandmother was one of those kids, and if it wasn't for the school nurse, she would have died early in life. I'm sorry. I'm getting emotional here. And there's another thing Lillian Wald did for my family. I come from a proud, long line of lunch ladies. My ancestry goes all the way back to the very first lunch lady ever. My mother, I'm a Hungary, was a lunch lady. My grandmother, you're a Hungary, was a lunch lady. My great-grandmother, she's a Hungary, was a lunch lady. And my great-great-grandmother, Vera Hungary, was the very first lunch lady. In 1908, Lillian Wald started the school lunch program, and my family's been serving lunches to kids ever since. And I hear this Lillian Wald woman's done some amazing things, particularly around immigration and race relations.
Lillian Wald? I've been studying her for a long time, ever since I started nursing school. I think thousands of seconds of dedicated study to her career, and her contributions to immigrants' rights are one of the things that stands out the most, I think.
In 1908, the then governor of New York visited the settlement at Henry Street, and after meeting Miss Wald and seeing the scope of her practice, appointed her as a representative on the New York Immigration Commission. The commission led ultimately to the formation of the State Bureau of Labor and Industry, focusing on the safety and welfare of workers, including immigrants, who at the time were being discriminated against. She provided advocacy for the welfare of even more individuals who at the time had no voice. Later on, she worked with Dr. Lee Frankel to convince the Metropolitan Life Insurance board of directors to cover visits from public health nurses. Their logic was that healthy patients would live longer and save the company money over the long run.
And then she convinced them. The partnership lasted for about 44 years and permeated the public health industry, the entire public health system, nursing, insurance companies, and actually the entire insurance industry itself.
So, Ms. Field, what did Lillian Wald do for women?
What did Lillian Wald do for women? Where do I begin? Okay, first of all, a little history background. The attitude towards women during the early 1900s were that they were emotionally and intellectually inferior to men. This perception was further reinforced with laws that prohibit women from voting. In addition, women had no property rights, no parental rights in the eye of the court. Women had limited educational and employment opportunity. Imagine receiving a letter of rejection from a college or university because of your sex. Basically, women were second-class citizens. Lillian Wald started championing for women's rights when she was a nurse traveling through the tenements of Lower Manhattan. She witnessed women and children living in substandard conditions because their father or husband abandoned them, and the chances for them to get out of this situation were slim. Many women died, and their children were placed in orphanages. She advocated for these families and lobbied changes in the New York divorce laws. Her persistence paid off, and alimony was added on to the law. I could sit here and talk about Lillian Wald all day, her role in the women's suffrage, her work with women's trade unions, even her participation in women's birth control right. But I have a client's coming in soon. But I will leave you with this. Lillian Wald was more than a nurse. She became the voice of the underrepresented.
In 1893, Lillian Wald coined the phrase public health nurse in order to give a title to the work her and her colleagues were doing in the poor communities of New York City. It was in these communities that she was able to make the deep connections between illness and poverty. What started as a focus on community health ended in a phenomenon in national public health. Wald and her colleagues understood that to improve the health of the community, they needed to provide curative care, but more importantly, preventative care, primarily in the form of education. Her innovations in public health, while largely invisible today, are still very much a part of our daily lives. We see school lunches, special education, early childhood immunizations, and education in nutrition and sanitation as examples of programs that were initiated as part of this era, still valued in our society today. Wald's largest success may have been the Henry Street Settlement, which in 1912 had over 28,000 people enrolled in its programs and is still open and providing services in the community today. Also in 1912, the American Red Cross Public Health Nursing Service launched across the United States. By the early 1920s, over 3,000 public health nursing organizations were available in this country. It would be amazing if I could accomplish a fraction of what Lillian Wald contributed to this country. From home visits to national policy changes, her contributions to the profession of nursing and public health are truly astonishing.
Hoagies and grinders, navy beans, navy beans, navy beans, navy beans, hoagies and grinders, hoagies and grinders, navy beans, meatloaf sandwich, sloppy dough, sloppy dough, yeah, sloppy dough, sloppy dough, yeah, sloppy dough, sloppy dough, yeah, sloppy dough, yeah. Trip one morning that I woke up to see all the pepperoni pizza was looking at me. It screamed, why do you burn me and serve me up cold? I said, I got the spatula, just do what you're told. Then the liver and onions started joining the fight, and the chocolate pudding.